Welcome back, you guys, to Hustle and Highlight. We have a special guest today. Her name is Rachel of of Bloom Health, and she is a physical therapist. Tell us a little bit about yourself.
So my background, I'm a physical therapist, like you said. I've been practicing for 13 years.
Okay.
Long time.
Yeah.
I started out specializing in pediatrics, actually.
Okay.
And so kind of in undergrad, got into volunteering with summer camps for kids with special needs. And then in graduate school, kind of decided, okay, that's the path I wanted to go for physical therapy. Nice. And then I did that for about 8 years. And then I was dealing with my own pelvic health issues, pelvic pain, things like that. And I kind of dove into the world of pelvic health in general. Yeah. And I worked at a children's hospital where they had it's called a colorectal program. So helping kiddos with different gut health stuff.
Fascinating.
There's a whole world to it.
Yeah, I bet.
And that's where I dove into just pelvic health as physical therapy in general. And kind of shifted gears. So I still do pediatrics, but I also now really specialize in pelvic floor PT for women, men, and kids.
Okay.
Yeah.
And so how long have you specifically been doing just the pelvic floor thing?
Probably about 4 years.
Okay, nice.
Yeah.
I feel like a lot of people don't realize how essential your pelvic floor health is. And I really didn't until after I had kids.
Yes. Yeah. It's I feel like once I started diving into it, I was like, why is this not the cornerstone of every physical therapist's education?
Yeah.
And then, just the general public too.
Is that kind of where it all starts? Like when someone comes to you for physical therapy, do you start there usually? Pelvic floor situation?
Yeah. I mean, it depends what they're coming to me for.
Okay.
If they're coming and they've reached out because they're dealing with say a mom and she's like, I pee my pants all the time.
Oh, that is so terrible.
We're going to start probably there, but my approach is never just to zone in on the pelvis and the pelvic floor.
Yeah. Okay.
You come in for your first appointment, I'm looking at you head to toe.
Okay.
And there's usually an element, no matter who comes through the door, of some pelvic floor issue that we can address as well.
How often does that happen? Just out of curiosity, where am I? Because I feel like it must be more common than we know.
Yeah.
Where women come in after they have kids, right? Usually. And they're like, I can't sneeze without peeing my pants.
Yeah. The statistics on it, it's pretty high. So, and it goes up as we age. So as women, by the time you're in your 70s, 80s, the percentage is something I think it's between 70 and 80% of women in elderly age group are dealing with incontinence.
Yeah.
And it's, each decade it's gone up from there.
Wow.
So women postpartum, it's pretty high.
Yeah.
And it just gets normalized, but it's
it's terrible.
It doesn't have to be.
You don't have to pee your pants and wear a diaper at 35.
Well, even just not the peeing your pants, a lot of people deal with prolapse and stuff, right?
Yes. I just learned about that.
Yeah.
Okay, so before we dive into this, can you explain to us what exactly a pelvic floor is?
Yeah. So everyone has one. If you're walking around with a pelvis, you have one.
Yes. Okay. Good to know.
And so the pelvic floor is it's a group of muscles. A lot of times we think of it as one muscle. There's actually 3 layers and right and left sides. And they sit in the bowl of our pelvis. And so those muscles collectively do a lot. Most people think about a Kegel or Kegel, and that's that squeezing motion.
Yeah.
That's one part of it. So they do squeeze to stop pee, stop poop, hold back a fart.
Yeah.
But they also lift, and that lift provides support to our core, support to our organs. Having a proper function of the pelvic floor, so those muscles being able to contract and relax and move freely, it helps with sexual health. So lubricating tissues, not having pain. Bowel and bladder, so not dealing with constipation, not dealing with leaks, not dealing with pain when you pee, all of those things. And then it plays a huge role in our back, our hips, our SI joint. So that's where the hip bones join the base of the spine.
Oh, wow.
That's
important.
Yeah. And that's me personally, I had pelvic pain, but it was because of an issue with my hip.
Oof.
And so like I kind of went through the merry-go-round of like trying to tackle my hip, but didn't get connected with the right therapist to help me out with the pelvic floor piece. And so it just kept happening.
Was that something like you were born with, or was that due to like
Yeah,
certain things that you've done in the past, or
probably
like?
more certain thing. I grew up as a swimmer and I played water polo.
Oh wow.
And I think it was the water polo.
Yeah.
Oh, interesting.
Yeah.
That's a tough workout.
Yeah.
Water polo. Have you watched that?
I watched
intense.
it. Yeah.
Yeah. I loved it. It was
Anything swimming, that like props.
That's amazing.
yeah. So I think
Now
that's
you do CrossFit, right?
yeah, here and there. So my husband, he owned two CrossFit gyms. And one in Napa, one in St. Helena. And he owned those for about 10 years and sold them when our son was about 6 months.
Nice.
So our garage is now like a full gym.
Okay.
Perfect.
So, yeah, I love it. I hated it at first, and now I'm like, okay, this is nice, actually.
Yeah.
But yeah, so I dabble in CrossFit workouts. My husband is funny though. He like does not like to train me because I cherry pick. I'm like, I don't want to do that. Give me something different.
You don't get an option.
Yeah, like let's mix it up. But yeah,
I love that.
Yeah.
I love the convenience of having like workout stuff right there at your house.
Yeah.
It's really like you really have no excuse now.
yeah,
You know?
yeah. It's like okay, pour my cup of coffee, walk into the garage.
Yes.
Yeah.
Easy. And then
Yeah.
you can have your son there too.
Yes.
So easy.
Run
Yeah.
around.
So what would you say the number one thing? I just want to focus on pelvic floor because I feel like a lot of our audience are women,
Yeah.
and this is something that they could definitely use education.
Well, and it's just easily overlooked.
It is.
Yes.
Yeah. So
Yeah.
what's like the number one thing you see in your practice when it comes to like women and pelvic floor issues?
I would say for me personally in my practice, it's a lot of pain.
Okay.
So like women who have been dealing with pelvic pain, or like chronic low back pain, and they kind of have been just dismissed and like,
oh, this is normal.
yeah, like this is
getting
normal. Oh,
older.
relax. Oh, like all the things. So I feel like by the time they come to me, there are people who have like hit kind of dead ends with other avenues.
Okay.
And so that tends to be what I see most is like a lot of women who are just, and when I say pelvic pain, it can be like pain with sex, or pain, like really painful periods, pain when they pee, like all of these things. And it's just kind of, again, it's just, unfortunately, it's made to be normalized.
Yeah, that's terrible.
Yeah. So that tends to be most of who I see. And like I've had a handful of patients where they've been made to feel like, oh, your pain is related to a UTI. And you just keep having this UTI. So they stop testing for it. And it's like,
But then they just throw antibiotics at them all the time?
Yeah.
Oh my God.
And then you have to
and
heal
it's
off
actually
those.
nothing to do with the bladder. It's all to do with the
Interesting.
pelvic floor. So like,
Wow.
if our pelvic floor holds tension, which it will do for a number of reasons. If you have an injury in your hip, if you're like emotionally stressed,
Oh, there
that
it
can
is.
manifest as tension in the pelvis or in the pelvic floor. And so then you
How
get
interesting.
pain. Yeah.
So is there a lot of like gut health correlation, obviously, with pelvic
Yeah.
floor health that you deal with? And
Yeah.
as far as like if you recommend like a probiotic or anything like that, like how does that work?
Yeah. So like as a physical therapist, I have to be mindful about what I recommend. Like,
Yeah.
I can't recommend.
You're like, I'm not a doctor, but
Exactly.
also
Yeah. And so I tend to focus on like, okay, let's look at your fluid intake, your fiber intake. A lot of times if somebody's coming in, depending what they're dealing with, I'll ask them to like for 3 days, just record everything you're eating and drinking.
Okay.
And then I'll look at that for them and kind of figure out, okay, how much fiber are you actually getting? How much fluid are you actually getting? Like what are the triggers that might be kind of spiking your pain? And then we go from there.
Oh, nice.
So
Okay.
yeah, so
Awesome.
like kind of take that approach, and then I
want to come.
I know, right? Do
Yeah.
you find that a lot of people are under consuming fiber and
Yes.
fluids?
Yes.
I feel like that's
Yeah.
common for a
Yeah.
lot of people.
Yes,
Interesting.
yeah, definitely. Like a lot of people are kind of borderline dehydrated and not realizing it. And then a lot of people, like you ask them about bowel health and like, oh, I'm fine.
Yeah.
And then
'cause
you
they don't
start,
want to talk about it.
they don't want to
Yeah.
talk about it, or they think they're fine. And then you start asking more questions, and it's like, ooh, actually, like you don't realize it, but you are constipated.
Yeah.
Yeah.
Like, or you like that pain that you get should not be happening.
Yikes.
So
I'll ask a poop question.
Yeah.
How often is someone supposed to poop?
it varies.
Okay.
So like there's kind of a range of normal. Some
Okay.
people are like once a day. Some people will go multiple times in a day. Others are every other day or every 2 days.
Every 2 days?
Yeah, that's like really stretching it out. And what I like to tell folks when I'm talking to them about like how often they're going poop is, how do you feel? Like, what makes you feel most comfortable? If you're like, I go every other day and I feel sluggish, I feel bloated, then like, okay, we should get you on a once a day.
What do you recommend for people who need to like up their poop? Like, how is that? How's that
Go
work? Is
more.
it, like more
Like, what do I do?
fiber and fluids?
And it depends because there's like different kinds of fiber. So you don't want to just throw more fiber at it. So you want to, and that's where like really kind of diving into like, okay, what are you eating? What are you drinking? Most of the time it's as simple as starting with increasing some fluid.
Okay.
Not being distracted when you're trying to go poop. So like no scrolling.
Yes. Or to like no toddler.
Yeah, no toddler interruptions. That's the hardest. Yeah. So like kind of how you're actually creating a schedule around it. So like it sounds silly, but it can be really effective of like having a schedule, having a routine, and basically training your body.
I feel like men are good at that.
Men are very good at that.
Like
right?
the morning poop, the afternoon poop.
I'm going to be in the bathroom for 45 minutes.
Yeah.
Do you need anything before I lock the door?
Yeah.
They're playing us when it comes to that. Nobody should be in there that long.
No.
But
That's funny.
Yeah.
Their legs are going numb.
Yeah.
On the toilet.
Yes.
Yeah. Wow. Okay.
Or like
interesting.
massage and stuff. Like I teach folks how to do a tummy massage on themselves, or like
Okay.
I'll do that for them
So
in the
do you
clinic.
like the whole lymphatic drainage kind of route? Like as far as that goes.
Yeah, I mean, lymphatic drainage can be super helpful. What I teach patients when they come in is it's like a colon massage.
Okay.
So basically trying to
Direct it
stimulate.
through.
Yeah,
How
exactly.
do you feel about colonics?
They can be helpful.
Yeah.
Like I don't love them as a go-to.
Yeah.
Because it can be disrupted to your gut biome.
Okay.
Yeah.
So,
It'll
like-
flush all of it out.
Right.
Like
The
you
good
need
stuff.
that bacteria in there,
Yeah.
right?
Yeah.
Interesting.
So our body does, as long as we're healthy, we're giving our body what it needs. And part of that too is physical activity. So if we're
Yes.
not active, we're not going to poop.
Yeah.
But our body should do a pretty good job of flushing itself out. Now there's things that are going to happen where that will be disrupted, but making sure that like being mindful of the gut microbiome if you are going to go the route of colonics. So,
Interesting.
And usually I think the better clinics will tell you like,
Yeah.
you know,
Don't come
How to
often.
regulate it.
Yeah.
Okay.
yeah.
Good to know for you.
I went once.
Yeah.
Yeah. That's why
But she swears by it. She's
Yeah.
like, everyone needs to go. It was
Yeah.
great. It was easy. I'm like,
But
I
Like
know.
a good poop feels great. Right?
Yeah, like you feel like a new person afterwards.
Yeah.
Like I just lost 10 pounds and now I'm ready to go.
Yeah.
Yeah.
My
And it
clothes
was
fit better.
And you'd be
It's all
surprised. What is your long intestine like 7 feet long or whatever? Something crazy? Like
Yeah.
get it all out.
good. Yeah. Yeah.
Flush me out. Yeah. I was going to say too, like I tell all my clients this and you guys are on the same page, but like with pelvic therapy, there is no such thing as TMI. It's like,
Yeah,
you're, like,
no.
yeah. So ask away.
Yeah.
I love that.
I love all the,
Yeah, yeah.
I could talk about poop all
I'm
day.
kind of curious as far as like people. I don't know how often you deal with people with prolapse or anything like that.
Yeah.
How does that go? What do you recommend? All things like that.
Yeah. So prolapse is one of those, I feel like people when they
And
hear it
for
are
people that don't know what it
terrified.
is, what would you
Yeah.
explain it as?
So I explain it as like a laxity in the support of your organs in the pelvis. And so a lot of times people think like, oh my gosh, my bladder's going to fall out of my body. And it's not. That won't happen.
Okay.
But
what does fall out though?
the one, like the organ that could kind of make its way towards the vaginal entrance is the uterus. So you might see the cervix. That would be in really severe cases. When it comes to like the bladder or the rectum, it's basically you have the vaginal canal sitting in between. And there should be support structures that keep bladder forward, rectum towards the back.
Right.
And if there's too much laxity, which childbirth's a big cause of that, then you might get where maybe bladder's coming down and pressing into vaginal canal or rectum will do that. And so you'll feel or see a bulge. And people may, like, it can kind of come and go. If we're holding our breath a lot, if we're lifting our toddlers, you might notice it more. Or if you're on your feet all day, you might notice it more. So it's one of those, it's not always like fixed, meaning like it's not always the same.
Right.
But yeah, it's basically a lack of support. So we have these normal support systems, either by muscle, ligaments, kind of just where our organs sit, and then that can be disrupted. So we get where, we have a bowl and those organs start to kind of slide down.
Oh.
The reason why I ask is I know I've heard a couple people say that they've had to get surgery on that.
Yeah.
So that's why I was curious.
Yeah. And you can, surgery is an option. And it's also one of those, like, if you don't address the underlying why did this happen in the first place, the surgeries don't always last.
Like it'll happen over and
It
over
can happen
potentially?
again. Yeah.
Oh.
And if we think about, like, the big underlying factor is pressure management. So if we lose strength in our core, which happens when we have babies or it happens when we're pregnant, then we start to brace in other ways and kind of make up for that. So we'll hold our breath, or we'll like kind of just do like this all or nothing, like, if you were trying to pick up a heavy bag of groceries. And so if we do that over and over, or we're holding our breath a lot, we create this pressure down. And that pressure down, like, something's got to give, and it can push down on the pelvic floor. So if you've had a surgery, but you don't address like how you're lifting, how you're engaging your core, then over time you can just undo that surgical support.
Wow.
Yeah.
Fascinating.
So does that go for, obviously, if you don't have surgery, you just have a weak pelvic floor, your core strength could help support.
Oh, yeah.
Obviously. So they go hand in hand.
They
They're
go
not
hand
the same
in hand.
thing, but they go hand in hand.
Then they should work together. Like, your pelvic floor muscles really don't work in isolation. They're working with the other, like, your other core muscles. So working with your diaphragm, working with your abdominals, working with some of the small muscles in your back. And so if that system's disrupted, or your team is kind of like split apart, then you're going to get troubles. So it's making sure like everything's working together.
Okay. So for pregnant women, would you recommend obviously doing some kind of like a pelvic floor workout through the pregnancy and then thereafter, of course, right?
Yeah,
Okay,
definitely.
interesting.
Yeah, and I have a pregnancy program that I take women through, and I have a postpartum program as well. And part of the pregnancy program is just making sure like you're maintaining the proper strength of the pelvic floor, proper breathing mechanics, proper core coordination and strength to carry you through your pregnancy. And then like we switch gears towards like week 34 and focus on, okay, now how do you effectively go into labor and work on the pushing phase and positioning and like all those things. Yeah.
Helpful.
Yeah.
Yeah.
We should have done this a long time ago.
I know. Yeah.
Yeah.
Seriously, we're not having any more kids. It is what it is now.
Yeah. Yeah.
Interesting. So like after I had both my daughter and my son, I wasn't a big rule follower. And so my midwives would be like, oh, just rest for, like a week. And I was like, yeah, okay. And I would go home and do like the dead bug workout like, just little. I was so afraid that like one of these things were going to happen that I was like, I'm not wasting any time here. Like, I'm sure I could heal a little more lengthy.
Yeah.
But I was just like so concerned about my pelvic floor and it not getting back to like, obviously it's not going to be where it was, but just getting back to good, I guess.
Yeah.
So what would you recommend like postpartum? Because I feel like it's one thing when your doctor's like, you need a rest for a month, but like what is realistic, or is it just kind of like catered to different people? Would you say
I would say it's more like catered to the person.
Okay.
So a lot of what's going to determine that is like, what was your birth like?
Yeah.
Was it a lot of women have traumatic births, whether it's emotionally traumatic or physically or both.
Yeah.
And so then that's someone who like maybe they really do need to focus just on rest and like kind of
For
the
example,
recovery.
I had precipitous labor.
Okay.
Both births. So my
Yeah.
first one was only 4 hours long, start
Oh my
to finish,
gosh.
and then my second one was an hour and a half.
Wow.
So it's like, it's great.
Yeah.
But it's also like I got hit by a truck, you know?
Yes, absolutely.
And they come so fast. So like I
Yeah.
can only imagine how my pelvic floor is.
Yeah, that's wild.
Yeah, and like a precipitous labor is definitely like a risk factor for having complications down the road, just because like your body doesn't have that time to like
Heal.
those muscles stretch and heal and like all the things that happen.
Fascinating.
Wow.
Yeah.
Wow. And I'd imagine for women that have a C-section, it's even harder, right? Because now you're like sliced through.
Yes.
So your healing is like a whole nother level.
Right. It's major abdominal surgery.
Yeah.
And like for some reason we're just kind of like, oh, you're fine.
Yeah.
Here's this like
Walk in
8 or
6
9
hours.
pound baby and like
Right. Good luck.
Yeah, good luck.
Yeah. Yeah.
Good luck. Feed this baby. Keep it alive.
Right.
And,
Oh, but don't hold it
Yeah.
too often because you don't want to hurt yourself.
Right.
It's like,
yeah.
yeah.
Yeah,
That's
I
wild.
get a lot of women who've had a C-section delivery and they come in even like multiple years down the road.
Sure.
Because they're still dealing with pain at their incision. Or they still feel like if I stretch, it feels like it's going to rip.
Oh
so,
my gosh.
Like, we'll work on kind of freeing up some of that movement, like getting their coordination back.
That's terrible.
Yeah.
Oof.
What do you think is like the biggest misconception of that people think about pelvic floor therapy?
Ooh, that's a good question. I think like, I would say that because of the way it's run in our like big box healthcare system, so like the Kaisers of the world, the Sutter, like all the bigger places, right? Your insurance based, that it doesn't work.
Yeah.
And the reason it doesn't work in those settings, and the whole reason I started my practice and not dealing with insurance, is because they're like limited to either a 30-minute appointment or people are waiting 6 months to get seen.
It's very cookie cutter.
It's cookie cutter. And then once they're in, they only get to see their therapist for maybe it's like every 6 to 8 weeks. And so that doesn't work. Like you need more of a hands-on approach to be able to help people get over kind of the initial phases of healing. So I think that's a big barrier right now where it's like people like, well, I tried it and it didn't work for me. And it's like, yeah, no kidding. It didn't work. So I think that's a big one. And I think the other big one is like, oh, it's just for women who are like peeing their pants.
Okay.
And not realizing like all the other things that we can help with. So that it really is foundational to like people dealing with like I had a CrossFitter who came to me and she was like having a really hard time at like high level workouts with pain in her tailbone and like leaking sometimes.
Yeah.
And so we worked through that for her, but it's like she never had kids. She wasn't.
She's lifting so much, maybe?
I think so. And I think it was like she had actually had a fall on her butt, like in childhood. And it kind of was, had some lingering implications.
Wow. Interesting.
Yeah. So it's like,
Holy moly.
it's not just for people who've had kids or people who are pregnant. It's,
Well, that answers my second question.
Yeah, same. Okay, interesting. So do you see that a lot with people in general who do a high impact workout like CrossFit as opposed to someone who's like doing Pilates?
Yeah, and I think like each athlete or each type of workout is going to carry its own issues.
Totally.
So like my folks who are like higher level weightlifting, so like CrossFit or weight training, what we don't realize is like if you can be physically fit and super strong, but if you haven't actually trained and done some accessory exercises for the pelvic floor specifically, you're not actually training your pelvic floor to be able to support a 200-pound lift.
Oh, that's scary.
They've looked at people who like do running for workouts compared to CrossFitters, and pelvic floor strength was the same across both. So even though their workouts are drastically different, if they weren't specifically training to their sport for like what the pelvic floor needs to withstand, the pelvic floor was no different.
Wow.
Interesting.
Yeah. So like you have to kind of tailor it that way.
So everybody needs to pay attention to their pelvic floor regardless of what workout they're doing and making sure they're like engaging their core correctly and supporting your pelvic floor on the daily, really.
Yeah.
Right?
And just being mindful. It doesn't have to be like, most people walking around are not going to have an issue with their pelvic floor. But if they are, they're like wanting to get to like the next level of their sport, then that might be something they need to look at.
Right.
And then vice versa, like people who do Pilates, especially Pilates instructors, they tend to actually hold too much tension in their pelvic floor because they're cueing people to like pull in and engage all day long. And so they end up with kind of the opposite problem where their pelvic floor might be strong, but it's holding way too much tension. So they end up with like some pain or that pressure down because of this cue of like pulling in.
Yeah.
Which is great.
Yeah.
But
to
being
an
mindful.
medium.
Yeah. You have to like balance it. Yeah.
Interesting. Wow.
How about, I mean, men? Do you get a lot of men? Like, what are their issues?
Yeah, with the pelvic floor, I mean, that's never addressed in our world.
No, I know. Yeah. So with men, it's like kind of funny, but so women will come in after years of dealing with peeing their pants, right? It's just like, okay, fine. Like it's been 10 years. I'll finally fix it.
Yeah.
Yeah.
Men, the second they have
something, they
are like getting into
Freaking
BC.
out.
Yes. Yeah. And so sometimes it's, rarely is it leaking. Usually it's, they have some kind of pain. So there's a whole lot of like nerves that also live in the pelvic floor. They kind of weave in and out of the muscles there. And so you can get where like a nerve will get pinched and then or compressed and you get pain. And so a lot of times men might have like pain at their penis, their scrotum, like something, and they'll want to come in for that. Yeah. Or tailbone pain, that sort of thing. And then the other side of that would be guys who are dealing with anything with the prostate. So if they had prostate cancer and they're going through surgery, they absolutely need pelvic therapy because they're going to be dealing with, unfortunately, they'll deal with leaking afterwards and erectile issues and all kinds of things.
Oof.
Yeah.
Yeah.
Interesting.
I can imagine like the pressure after that kind of surgery would be awful.
Yeah.
Oh,
yeah. So
poor guys.
Yeah.
Yikes.
So for someone that wants to like improve their pelvic floor health today, what would you recommend?
Ooh.
Like what's something like people just walk
like a
around
small
all
change.
day. Yeah. What's something someone could do?
So one of the things would be like just kind of tune into your body and focus on like how are you breathing? That's like kind of a good foundational starting point.
Okay.
And notice are you someone who's breathing in your chest all day? Are you actually like getting your breath out of your chest and kind of expanding through your rib cage? Not necessarily belly breathing all day, but like, are you getting more of that kind of fluid expansion?
Like in your diaphragm.
In your diaphragm.
Okay.
Because if we're not using our diaphragm, that sets us up for building up pelvic floor tension. And that tension, when I say tension, it means like you've kind of taken those muscles and you've like, it's like they're ready to go, but they're kind of almost on the verge of holding a cramp. They're just not moving well. And so that can set you up for pain. That can set you up for bladder leaks. That can set you up for prolapse, all the things.
Okay.
So starting with your breath is really a good one.
Okay.
As a self-test, you could, this will sound silly, but if you were to take a balloon, like you're sitting up and you take a balloon and you blow up the balloon and try and see like, where do I feel my body creating pressure? And if you feel any pressure down, like if you're sitting there and you blow up a balloon, you feel pressure down in your pelvis, like it's pushing, that's a sign like we need to work on your pressure management. So if you were like blowing up kids for your, balloons for your kids, and it's like every time you blow into the balloon, it's creating pressure down, that's a sign like, okay, let's work on some things.
Wow.
But your breath is really powerfully connected to the pelvic floor. So that's kind of like the safest starting point.
Just like how you're breathing.
How you're breathing.
Something as simple as that.
Yeah.
Well, now I'm going to be paying attention to
I
my
always
breath
see
all
those,
day.
like, on Instagram and stuff. I always see this like Kegel breath work class, and they're like, "Dude, let's do it together."
Yeah.
breathe in, breathe out.
Yeah. But the breath is like, it's a great starting point. And it's like, no matter what, if you're holding tension or you have weakness, it's kind of like the safe bet of where to start.
Okay.
Yeah.
Yeah. Without like knowing for certain which way. And then staying hydrated is another one. Making sure you're getting plenty of fluid.
How does dehydration directly affect your pelvic floor? Is it because the constipation situation, like nothing's moving correctly?
Nothing's moving. So constipation, and also it can make your bladder irritable.
Okay.
And so by that, I just mean like your bladder wants to empty whatever's sitting in it. So if we're dehydrated, our urine gets more concentrated.
Yeah.
And then it's like get this out.
Okay.
And so that bladder irritation can then irritate the pelvic floor muscles, and you just kind of create this cycle. So
I feel like there's so many people who are like, I don't want to drink regular water. It's boring and I don't like it. What do you...
Get over it. Drink the water.
I mean, that's how I feel. Yeah. But for someone who would say that to you, like, I'm not drinking what, maybe it's like a grumpy old person who's like, I'm not drinking water. I never have. And I'm just not starting now. So like, what do you recommend for them?
I'll give them suggestions on like, okay, can we infuse your water? Can we like add something to it? If there's someone who's already dealing with a bladder that's kind of irritable, they have to pee all the time, they're like that sort of thing, then I'm not going to tell them to put like lemon or strawberry. Like you want to stay away from the citrus, but I might suggest like, can you do mint? Can you do like something else to flavor the water? Or like the electrolyte powders.
Yes.
Adding whether it's the LMNT or the Relights or whatever.
Yeah.
Something just to like
Flavor.
get you drinking a little bit more.
Okay.
Yeah.
Interesting.
And it, liquid is going to hydrate you, so it doesn't have to be water. Water would be ideal, but like meeting the person where they're at.
Right.
Yeah. Sometimes it's baby steps.
Yeah.
Yeah.
I'm sure.
Yeah.
So did you start in like a Kaiser Sutter or anything like that?
Yeah, I've worked in both a Kaiser and a Sutter in pelvic health, and like knew immediately I'm not doing this forever.
Yeah. Okay.
I have my own practice now.
Yeah.
I love that.
Which is great that you branched off. How's it been going from like essentially like corporate to like owning your own?
It's been wild.
Yes. You've learned a lot along the way.
I'm sure.
Yeah. So it's been probably more difficult than it needed to be, just because like my husband and I, we like, it's like when we like to do something, we like to do it the most difficult way possible. So I switched to like doing my own practice at the same time he completely switched his career.
Wow.
So he was a gym owner for about 10 years and then is now a firefighter.
Oh.
And so he like sold his gym, went through EMT school, went through firefighter training.
Oh my gosh.
And
And
then
you had just had a baby too.
and I had just had a baby. So this was happening with a 6-month-old.
Wow. Yeah.
Yeah. So it was like,
Overachievers.
Yeah. We're
love
going
it.
all
let's
in.
just go for it.
Yeah.
So that was hard.
Yeah.
And then he was kind of on the job hunt. And so I was our sole provider. And so I was like opening my business, but kind of doing that half in, half out, because I still had to provide benefits, like all the things. And then he got hired. So this was like a 2-year process. He got hired.
gosh.
He's now in an academy, which is a whole nother whirlwind where like he's gone Sunday night to Thursday night every week.
Wow.
Yeah. So it's a lot. Like when I say we do it the hard way, we do it the hard way.
Yeah.
So it was wild in that regard. But once I was able to like fully commit myself to my own business, it's just taken off. And I feel so much more fulfilled working for myself.
Totally.
And being able to like see and treat people the way I would want my friends and my family to receive care.
Well, you just build better relationships that way.
Yeah.
It's not like we said cookie cutter, like
Exactly.
in and out, that type of thing. You know, it's really like curated to each person.
Yes.
Yeah.
Yeah. And it's like, I don't see anyone for less than an hour. All of my appointments are
I saw that on your site. That's amazing.
Yeah. And I keep my schedule where I can see someone once a week if that's what they need. I have a couple people who come to me twice a week.
Okay.
And so it's like that would be unheard of if I were working for any other like
That's
clinic.
not allowed.
Yeah.
Like get them in and out, hurry up.
Yeah.
Yeah.
It's like 30 minutes, move on.
Yeah, that's amazing what you're doing now. I love that.
Yeah,
Just
so-
building a connection with people and actually helping their specific needs as opposed to not.
Yeah, exactly. So it's been rough though. I won't say it was easy.
Yeah. Oh,
Yeah.
I can only imagine. It's like you can't be any more opposite, right? Like
Yes.
just flipping the script
Yeah.
all the way.
Like just, both of us completely.
Yeah.
Just 180. So it's
Well, when he's out of academy too, it's going to be like, whew.
Yeah.
Yeah. Like right now it's a little,
Do you feel like do you tell yourself all the time, it's not going to be like this forever?
Yeah.
Yeah.
It's like there's light at the end of the tunnel.
Yeah. This is just a season. Yeah.
It's been a long season, but it's just a season.
Yeah. It's a season.
Yes.
We'll get
Yeah.
past it.
Yeah.
Amazing.
Yeah.
Okay.
It's been fun though.
I love that.
I have a Kegel question. So
Yeah.
How often do you recommend somebody, I mean, I've heard like so many different things, but if someone was needing help in that area, how often would you recommend them to do Kegels? I mean, you could do them anywhere, so like, why not?
Yeah. I usually don't recommend
Really?
Kegels. Yeah.
Okay.
And it would be rare. Probably the one group of folks who I do recommend like just isolated Kegels is my men who have had a prostate surgery.
Okay, that makes sense.
Because they need to like bulk up the muscles of the pelvic floor to make up for what the surgery took away.
Okay.
But pretty much everyone else, I don't recommend just Kegels.
Okay.
So I will have them work their pelvic floor with doing like lunges or doing bridges or single leg jumps or like kind of all the other things, but just isolated Kegels. And the reason for that is those muscles they're not really intended to work alone.
Right.
They're not meant to like just kind of squeeze and relax.
Yeah.
It's a good place to start if you're like, I have no idea if I even can get my pelvic floor to be active.
Yeah.
But then we move on from there really quickly.
Okay.
Yeah. So
Interesting.
it's one of those I usually don't. And I like to, if people come in to me and we need to strengthen their pelvic floor, I'll be like, okay, what exercises are you doing? What's your typical gym routine already? And then let's take like some of the moves that you do 3 days a week and let's layer in a pelvic floor contraction to that.
Okay.
And I'll teach them, here's how your pelvic floor should be working when you do a deadlift, when you do a squat, because it's much more functional that way.
Yeah. Yeah.
Yeah.
I love that. So you just work it into your
Yeah.
regular routine.
Yes. Yeah.
It's funny that you mentioned the lunges because after I had my daughter, I was not knowledgeable in this at all. But I was, right after I had her, I'd go for walks and then I would like attempt to do lunges on my walks. And I was like, why can't I do this? Like, it's a lunge. That's weird. But I felt the pull. I was like, oh, I'm not going to make it. Like, we're not there yet.
Yeah. Yeah.
But interesting.
Yeah.
So like connecting the two. I mean, just when you hear lunge, you think, oh, legs and butt. You don't think like pelvic floor. Yeah.
Or another great one is, which is very humbling postpartum, but like a plank can be an excellent
no, ma'am.
pelvic floor. Yeah. I remember
because we are like in our, well, she's always been, but I've been going to the gym a lot more with her, and now we're going to change her workout.
Yeah. We're just going to pay attention to things.
Yeah. You just kind of tune in and see like, okay, wait, how am I moving? How am I holding my breath when I try that? Like
instead of leg day, we're going to do pelvic floor day.
Yeah. Every day. Layer it in. Yeah. Well, and I remember I worked out throughout my pregnancy all the way up until I couldn't, up until I was, going into labor. And so postpartum, I was like, okay, this will, I know it's going to be hard, but I'll get back to it. And I just remember when I tried my first plank postpartum, I was like, what just happened? I was able to do this at 38 weeks.
Fall on your face. Yeah.
But, and so it was really like, I knew it would be hard, but I didn't realize like, oh man.
Yeah.
This is humbling.
Right. Like you don't realize how crazy pregnancy is to your body. It just makes such a huge difference.
Yeah.
Huge difference. And then it's humbling, like you said, because you have to slowly, like I'm talking baby steps, build your way back to just where you were before.
Right.
But like, I don't know. I feel like sometimes it takes years. Like the body heals for, what do they say, like 2 or 3 years after you have a baby. So
God forbid you have them back to back.
Right? Yeah.
Right. I can't imagine. Yeah.
And it's one of those, I feel like having my son and going through that experience made me a better therapist myself, because I was like, okay, I get the struggle now. Like, this is hard.
Yeah, you understand it on a whole different level.
I knew it on paper, but now I knew it in my body.
Experience-wise, yeah, totally.
So, what's one thing that you wish like every woman knew about pelvic floor health?
Ooh, that that the's help available.
Yeah.
And that
some things aren't normal.
Yes. Yes. Like pain with sex is never normal.
Yeah.
Like
that's
pain,
so sad.
Yeah. Like that's a big one. And
what does that come from exactly? Like, can you explain that?
Like why it might be painful?
Yes. like why, like when someone is experiencing pain, like what is happening there?
Yeah.
Like organ wise.
Yeah.
What is going on?
Like, why is that?
Paint us a picture here.
Okay. So I should have brought my model.
Yeah, that would have been great.
Yeah. So when you have, first of all, there can be a lot of different reasons for it. I'll like the more common is like say you have pain with deeper penetration. And it's not like that pain just with initial. So that pain is usually from the muscles of the pelvic floor. So those muscles in our pelvis, they go from like our two sit bones, so the bony part of your butt across. So they make this sling that way. And then they go from your pubic bone to your tailbone. So like we've got this like bowl.
A T.
Yeah.
Okay.
And you can get tension. So when I say tension, it's like they're just holding, like if you were to kind of squeeze your muscle, like that's tense. So there's tension in that muscle. And it's like if you had like a Charlie horse and then someone pokes your Charlie, like as you're cramping.
Yeah.
And someone pokes that, oh, that's going to hurt.
Oh, yeah.
Yeah.
So just like that.
It's just kind of like
how to
that.
relax your muscle pretty much.
Yeah. And sometimes like it's a matter of stretching before sex or like working, the breathing piece is big deal. Different positions can help with that until we can get out of that pain cycle. Because what'll happen is like, oh, that hurt. And then your body remembers it. And so then the next time you have sex, it's like, oh, it's going to hurt.
Yeah.
And so everything tenses up and then it hurts again.
Interesting.
And so it just kind of feeds into this. And there's different reasons why that pain may have started in that first place. So it could be like, personally, I had pain with sex before I even had kids or was pregnant because I had a problem with my hip. And so my hip was all messed up.
From water polo.
From water polo, I think.
Okay,
I think it was from water polo, and then I did a stupid thing. I went on a run and like early morning and grabbed 2 different shoes. And I'm like,
oh no.
After that, then my hip, like I knew it was already an issue. And then after that, it was just like, okay, well, that was
so
really
that's
dumb.
another fascinating subject.
Yeah.
Do you recommend a certain shoe, like as far as like working out and stuff?
Yeah.
Because that correlates with your legs and your pelvic floor and all that stuff too.
And like when I say like I do head to toe, I'll look at folks like usually have them get barefoot and like watch how they're moving. And then we'll go over like footwear and like arch support, like or maybe no arch support. But so it's like, I had this hip issue and it created this tension in the muscles of the pelvis because they were basically trying to stabilize where my hip wasn't.
Yeah.
Wow.
And then I had pain from that. So
interesting.
There can be all kinds of reasons. And then you can also have just like the nervous system where you have.
That's me.
Yeah. It's like, like I've had someone.
She asks me all the time, how do I regulate my
I need to like reset it. Is there a reset button?
There is.
Is there? Tell me all about it. I could release it.
If you're on social media, you probably have heard of vagus nerve.
Yeah.
No? Okay. So vagus nerve is like our powerhouse for doing like a nervous system reset.
Okay.
And so a cranial nerve, so it starts in the brain, but it has branches all the way down to the bowl of the pelvis.
Okay.
And it's really linked into some of our automatic body functions. So if we get nervous and we start sweating or we get goosebumps, we're like it's stressed out and our stomach feels nauseous. Like those are the types of responses on a nervous system level. And if we can stimulate the vagus nerve, we can kind of turn down that fight or flight volume. So it doesn't go away completely. We always have to be a little bit ready to go.
Right.
But the vagus nerve can help kind of get us out of that like elevated state.
Interesting.
And actually,
I'm
like
stress sweat every day, like literally.
A lot of my patients who come in and they're dealing with really severe pain, I won't even go near the pelvis for first few visits, and I will work on like their vagus nerve and doing some stimulation techniques for them, starting up at the head and the neck.
Is that like physical manipulation, or is it? Oh, okay.
Yeah. And then teaching them some things they can do at home as well. But like actually like physically working on either stimulating the nerve or if there's tension in the muscles of the neck, that will compress that nerve. So releasing tension there.
Okay.
There's a whole...
I need to make an appointment.
I know, I was just thinking that in my head.
ASAP.
And then I try to integrate other things too. Like for the right folks, not every person, but I have like red light therapy that'll integrate into what I'm doing for people dealing with pain or healing, things like that too. Yeah.
Okay. Our gym just got a light stim red light therapy bed, and we're excited about it.
Yeah. I have a wrap at home I use almost every morning. And then at night, like that's my like
Zen area.
Yes. I love
I don't blame you. I need one for home.
Yeah. Love
like,
that.
I need 10 minutes at least.
So where can people find you? Shout yourself out. Like, what's your business called? What's your Instagram handle? What's the best place to get a hold of you?
Yeah. So my business is Bloom Health Physical Therapy and Wellness, or PT and Wellness. On Instagram, it's at Bloom Health PT. My website is the same, so www.bloomhealthpt.com. And then my phone number is 707-469-3359. So like any of the ways you can, I have people who reach out through DM or the website. The website's best. There's a form on there that you can fill out with your name and your info and like what it is you're wanting to get help with. Nice. And we didn't even like touch on it, but I like the whole side of pediatric pelvic health too is like a big one.
I saw on your Instagram there's like a reel or something where somebody, was that your son?
That was my son.
Okay, okay. Yeah.
So like
tell us about that.
Yeah, with little ones, it's fairly common for kids to deal with constipation.
Yes.
And the like Band-Aid solution if you take them to a pediatrician is Miralax. Like, just get them on Miralax, empty them out.
That's terrible.
And it's terrible.
For your gut,
it's
right?
Like, and so, and unfortunately for a lot of kids, like, they get stuck on this, like, Miralax merry-go-round. They just can't get off it because they get backed up.
That's terrible.
And so for our son, I kind of, like, he was pooping regularly, but then he started spitting up. And I was like, I think something's going on.
Yeah.
So he was constipated. He was backed up. And so we worked on just like intentionally a lot of core work, a lot of like rotation, climbing, breathing, and got to where like he doesn't have to use any Miralax. He's not spitting up. Like it's all good.
Nice. That must be hard with the little guy. Like that little, right? Like you could be like, do this. And he's like,
it's all like play. Like if you see me working with a kid, you're going to be like, this lady's not, what is she doing? Right. But it's all just like, it's play-based stuff, but like very intentional. So that's the other side of it. Like that's the most common is little ones with constipation.
That is so common.
Very common.
Yeah.
And so parents who are like just fed up with the Miralax kind of merry-go-round, we can get to where like we can get off of the Miralax. We can get where it's not a thing.
That's awesome.
I love that.
Yeah. Or like older kid. The other big one is older kids who are otherwise potty trained and then they're wetting the bed. And a lot of times we get that same messaging, very similar to like what women deal with of like, oh, it's normal, grow out of it.
Yeah.
It's not normal. It's not something to grow out of. Like there's usually some either body awareness, usually it's constipation, but some other thing going on that you can get to the root of and it not be a thing.
Okay.
Yeah.
It is so normalized that, they're a kid. It happens sometimes.
It's like, they're starting solids. They're going to be constipated. And like to a degree, that might be true for little ones, but it shouldn't linger forever.
Right.
Yeah.
Okay. Good to know.
Yeah.
My brain is so full.
I know. I love it so much. I'm excited to work out later today. And
we will be calling you.
Call me.
Yes. I'm just like, I'm doing a lunge right now. Yeah. How should I be breathing? Help.
Yes. Yeah. I know. It's like, I try to get my patients off the table too. So like with pelvic health, we do internal work. That's what makes a pelvic floor therapist different from your orthopedic. Is like I'm trained to be able to treat you through the vaginal canal, like get to these muscles directly. Or for men, rectum. They're not a big fan of that, but that's like it can be necessary. And for women too, depending on what's going on. But I like get my patients off the table. Like we're not just assessing you on the table. Like, you have to be standing. You have to see like what's happening when you squat, when you lunge, because sometimes that's where everything falls apart. So that's the other big thing. Like if you're listening and you're in pelvic therapy and not sure, like if you're not seeing results, if your therapist hasn't gotten you off the table, find a new therapist.
Yes.
Because it's,
that makes
we don't live
so much
down.
Yeah.
But it's like so common, unfortunately.
Yeah. Okay,
Yeah.
well, great. Well,
Thank you, Rachel.
Ladies, you don't have to live your life wetting yourself all the time.
You can sneeze and feel comfortable.
Yes, you can sneeze confidently. Go visit Rachel.
Yeah.
Thank you so much for coming on.
Thank you.
Thank you.